Good evening. In 2008, the New York Times ran a story on a woman named Trina Bichelle. Bichelle was having health problems relating to her pregnancy. And when she went to her local healthcare clinic, she was not allowed to receive coverage because she had been to that clinic before. Being uninsured, the clinic was required to charge Bichelle $100 per visit, which she could not afford. She then sought care at a clinic 30 miles away. However, by then, it was too late. Because she failed to get the care she needed in a timely manner, both her and her baby died. And while this is a terrible and obviously a very tragic story, these incidents don't happen nearly as much anymore thanks to the Affordable Care Act. Today, I'm here to talk to you about the Affordable Care Act and persuade you to believe that it is the best healthcare system for our country. I've done extensive research on this act to prepare for this speech, so I'm very informed that I feel qualified to speak on the matter today. After you walk out of this room, you will have the knowledge and the sense of empowerment to go out and stand up for this act and the further implementation of this act throughout the country. Beginning today, we'll explain what the Affordable Care Act is and how it works. I'll follow that by outlining the benefits of the act. And finally, we're going to look at the opposition's argument against the Affordable Care Act and counter it to reveal that the Affordable Care Act is in fact the system that the country needs. So to begin, let's explain what the Affordable Care Act is and how it works. On March 23rd, 2010, President Obama signed the Affordable Care Act into law, which was the first modern healthcare reform bill in U.S. history. What the act does is it's centered around an individual mandate which imposes a fine on anyone who refuses to get coverage. The act also includes different provisions that extend coverage for young adults, as well as those with pre-existing conditions. The act also works to hold insurance companies accountable by imposing the 80-20 rule. This rule enforces insurance companies to pay their customers a rebate if at least 80% of their paid premium is not used on their health care. So I want to ask, how many of you in this room are under the age of 26? Myself included. Imagine waking up one morning and you're sick as a dog. You know you need to go to the doctors, however, you know that you can't. So you don't have health insurance, therefore you couldn't afford a simple checkup, let alone an actual doctor's appointment. Before the Affordable Care Act, this could have and would have been your reality as well as mine. Before the Affordable Care Act, insurance companies were only required to cover someone under a family plan until they were 18 years old. And this is a huge problem. According to ObamacareFacts.com, in 2010, about 30% of Americans between the ages of 19 and 29 had no health insurance. Now, I'm fairly new to living on my own, so I couldn't imagine leaving for college, my parents moving 1,000 miles away, starting a completely new chapter in my life, and on top of all this, I'd have to apply for and find health insurance. And on top of this, I'm included in the PACE program at UF, so I don't have access to the UF clinics and didn't during my freshman year. So I don't know what I would have done were I to get sick this year. Thankfully, I never had to worry about these scenarios because of the Affordable Care Act, and I'm not alone. 3.1 million Americans, according to whitehouse.gov, gained coverage by simply remaining under their parents' plan until the age of 26. And this is a triumph for the healthcare crisis that America is facing. Now, does anyone in the room know anyone who has asthma or diabetes or is pregnant? And even if you don't know anyone who's being treated currently for these conditions, the chances are you know someone with a pre-existing condition. My friends and family, I know someone who has diabetes as well as asthma, as well as who is pregnant. And before the Affordable Care Act was passed, these people could be denied coverage for their pre-existing conditions, and oftentimes were. However, the Affordable Care Act changed this. Thankfully, the Affordable Care Act included a provision that banned insurance companies for denying people coverage because of their pre-existing conditions. And according to whitehouse.gov, 129 million people now have access to better health care because they can no longer be denied for their condition, which means that our friends and our families and the people that you just raised your hands about and know, they now have access to health care. Now, to shift gears, let's talk about the opposition's argument. While the Affordable Care Act has clearly done a lot of good, it has also come under heavy fire by the opposition. Congress has voted 63 different times alone to repeal the Affordable Care Act. So let's examine why that is. Many people claim that the U.S. cannot afford the Affordable Care Act. And while it's true that more of the congressional budget is now allocated towards health care, that doesn't mean that the Affordable Care Act has increased the country's debt. The Congressional Budget Office, which is a nonpartisan analysis, found that the U.S. could save $124 billion through the Affordable Care Act. And similarly, in 2013, a University of Massachusetts economics professor found that the U.S. could save $592 billion annually by cutting out the provisional waste included in the private insurance companies. These savings alone that I just talked about would have the power to cover all remaining uninsured people in the country. So the notion that the U.S. can't afford to cover all of its citizens through the Affordable Care Act is simply false. And in fact, we can see that the very opposite is true. Another reason people find the Affordable Care Act at fault is because they feel that they're rewarding freeloaders by essentially paying for their health insurance. Many conservatives are against the idea of paying for the health care cost of some lazy American without a job. However, Jason Furman, author of Who Has the Cure, found that 63% of the uninsured are in families where the family head is a full-time, full-year worker but is either not offered health insurance or doesn't enroll himself or herself or their family members. So this goes to show that our tax dollars are not going towards covering some lazy American, rather they are going towards someone who really needs the help. And I imagine everyone in this room knows someone in these circumstances. Because of the Affordable Care Act, our friends, our families, and people in this very city are able to get access to the care they need. And that is a monumental step forward in ensuring that no American should have to forgo getting the care they need because they can't afford it. So looking back at what we spoke about today, I explained to you what the Affordable Care Act was and how it worked. We outlined the benefits of the program, and finally I looked at the opposition's argument and revealed that the Affordable Care Act is working and it's what this country needs. I'd like for you all to imagine what the Affordable Care Act do if it's implemented further in the US. Imagine a country where no one has to wake up and think about, can I go to the doctors today? Can I afford it? See, I'd encourage you to stand up for this act. Now you know the facts, and the facts reveal that the Affordable Care Act is working. I encourage you to write or email or call your representatives to tell them what you think and what you know. Finally, I'd like to end this speech by including a quote from the founding of this nation. In the Declaration of Independence, it states that all men were created equal with certain unalienable rights such as life, liberty, and the pursuit of happiness. Medical well-being is such an essential part to life itself. And if the U.S. is as prosperous as many claim it to be, I believe that it's time that we provide this basic human right to everybody and this essential part of life to everyone as well. Thank you very much. Are there any questions?
Yes. So I've heard that one of the objections to the Affordable Care Act is that it would potentially cause people to, flock into the, doctor's office, and that everyone would receive less of a quality of medical attention. Mm-hmm. I mean, what are your thoughts on that? There's
multiple different systems for a system like the Affordable Care Act, for technically socialized medicine. So the argument that you just stated and the argument that a lot of people have against Canada's plan, which is a single payer system, is that the quality goes down, and a lot of people in Canada have stated that their wait times to get an appointment is crazy. They'll call the doctors up, and then 4 to 5 or 6 weeks later, that's when they get in, which, by then, how much good does it do? Right. So the difference between that is we don't have Canada's system, we have the Affordable Care Act, which is a different version for each country. And so the way that the Affordable Care Act works is that it allows you to remain under these private insurance companies that if you already are on a plan, and if you aren't, it gives easier access to enroll. So technically it's not changing our insurance systems or our the way that our doctor's appointments are set up.
Right.
It just allows easier coverage, and it allows more Americans to get access to those coverage. So that's why I kind of stated that it's what the U.S. needs, rather than, Germany has a great system, but it works for Germany. Britain has a great system, but it works for Britain. Canada has a great system, it works for Canada. This is the system that the U.S. needs.
Right.
If that answers your question.
It does. Thank you.
Awesome. Yes.
Do you know what happened? You mentioned that the woman that you mentioned on the onset, she passed away along with her child. Did her family do anything, or were they advocating for the Affordable Care? Do you know that situation?
I don't know that. There may be a follow-up story to the Times article. I could give you the link, but I don't know that the answer of that is. But it's not. Sadly, that's not an uncommon story, that a lot of these people just couldn't find the care, they couldn't afford it, so they went without seeing it, and then they died. And so that was one of the arguments of the Affordable Care Act and making it easier, is that it would prevent these preventable deaths from happening. So, but I don't know the answer to that question. I'm sorry. Any others? Wonderful. Thank you.